On Sky Channel 0185, on the web at radiofocusuk.com, spectrumradio.net, and also at ghanaweb.com. My name is Nana Kwame Oseitu, your host for the Super Morning Show. And my guest today at the studio is Anna Alford, Genetic Alliance UK. She's here to explain to us genetics in cancer, to throw more light on cancer that have a genetic or familial link, and also to encourage the uptake of services related to this. Anna, welcome to the show and good morning to you.
Good morning, Nana, and your listeners.
How are you doing this morning?
I'm fine, thank you very much.
Well, Anna, you are on our Super Morning Show, which is listened worldwide on Sky, on the internet, everywhere. So all over Europe, UK, and around the globe, people are listening to you this morning. We want you to tell us more about yourself, what you do at the Genetic Alliance UK, and all that you can tell us about you.
Genetic Alliance UK is the national charity and patient group supporting people affected by genetic conditions. And we'll talk about that a little bit more. We'll explain some of these big words and difficult concepts as we go through this interview, if that's okay. And we've done some research, some projects around the delivery of care in the NHS. That's the NHS in England for minority ethnic communities. And this has been around some genetic conditions. For example, you may have heard in certain communities of sickle cell disease. That one may be something that you would consider going to the doctors about. If you had a child born with that, you'd understand that that child might need some care for the rest of its life to ensure that when there's anything going wrong, that everyone knows they've got this problem and they need to get treated straight away. So that's one that may be familiar to you. But this word familial cancer is really talking about cancer that runs in the family. Sometimes people use the word inherited.
First of all, can you explain a little about the recent survey you did and the results it found?
Yes, well, with this research, although we called it survey now, what we really did was talk to people. That was important, to talk to people from the community about their experience of cancer in the family. And we found that people had not really heard much about cancer in the African Caribbean community, and they believed that it's a disease of white people. And sometimes people kept cancer hidden or secret. And also for the elders, cancer was a very frightening disease, which many people thought could not be treated or cured. Other people said it was taboo to talk about cancer and would cause people to think badly of them if they found out that they or their relatives had cancer.
Anna, what do we mean by familial cancer?
Well, again, we're back to these words, aren't we, which are quite technical in themselves and hard to understand for people. But can I just say, first of all, that only between 5 and 10% of all cancers are due to cancer being inherited. And that means passed down in families from fathers and mothers. So some people recognise genetics by saying things like, he's got his father's eye shape, or she's got her mother's nose. So people are already aware that the characteristics, that some of the ways people look is very similar in families. Even sometimes cousins can look really alike, like twins almost.
Wonderful. Which tumor or cancer type has this genetic or familial risk?
Well, one of these cancers is breast cancer. And breast cancer under the age of 40 is uncommon, but all women should report any abnormal changes to their doctor or nurse as soon as possible. Some women from the African community may be more likely to develop this cancer at a younger age.
Wow. If you just tune in, you are listening to Radio Focus on Sky Channel 0185, and my guest on the show today is Anna Alford from Genetic Alliance UK, explaining more about genetics in cancer. Anna, I also would like to know, is it important to find out more family medical history?
Yes, because if you're found to be at an increased risk, you could develop breast cancer. And this risk would be much higher than other women at normal risk. And because I'm talking to you as a man, Nana, I should also tell you that breast cancer occurs in men as well.
Ooh. I would like to know more about that. Because anytime that we talk about breast cancer, people think it's only related to women. So I think it will be a very good information to know more about even as men. Because, as you just heard, she said it's also related to men. Anna, how do I go about that?
Right, well, it's really important, Nana, to talk to your relatives, your listeners, especially people, if they've had cancer in the family, they need to start opening up more and just having that conversation. Like I said earlier, sometimes people want to keep it hidden. It may be very private. It may be, quite worrying for them to speak within the family, let alone to other people outside in their community. But this is the main priority. And especially sometimes people living abroad, their records, their medical records, they may not exist. They may not have them going back from a long time ago. So also bear in mind that some cancers may be linked. For example, sometimes if there is breast cancer in the family, there may also be some ladies who have cancer of the ovaries. And the ovaries are the part of the body where the eggs are made that transfer to the new babies that are made. So that's a very intimate cancer that maybe ladies might not want to talk about. But there's no shame in it. It's just understanding your body and knowing that sometimes you have to talk about all the cancers in the family, not just one single type. So what we'd expect people to know is what types of cancer someone had, how old they were when they got that cancer, so what age of diagnosis we'd call that, and what relationship it is to you. So whether it's your grandmother or an uncle on your father's side, or maybe your sister, for example. We want to know all of that information. Perhaps if I give you an example, that would make it a little bit easier. So if we were talking about an aunt on your father's side who has had cancer of the ovary, and she was only 46 at the time, and then she has a daughter herself, and her daughter gets cancer of the breast when she's 38. So that's your cousin you're talking about now. So there's two cancers already on that side of the family that are quite closely linked. And like I said earlier, remember to ask about the men, because they can pass on inherited cancers, these types of cancers, to their children, whether they're boys or girls, even if the man hasn't had cancer himself. You can still pass it on. So it's quite a lot to understand and quite a complex subject, isn't it, to think about.
So in short, you can tell us that it's very important for us to know about our family medical history.
That's the most important thing that people can think about today, and really begin to open up a dialogue. Talk to the person in the family who knows all this information. Usually there's someone, we call them a gatekeeper, but they're the type of person, if you ring them and say, hey, I've got this pain in my chest, they'll straight away say, you need to see the doctor, and your uncle so-and-so, he had this, and they know everything about the family. So they're a really good starting place to try and get that information, and maybe even record it, write it down somewhere. So you want to keep that information because it's important for your children to come as well.
Wonderful. So you just heard from Anna. It's very important for you to know about your family medical history. Anna, I would also like to know, what is the risk of me getting cancer with a family link? For example, in breast cancer, how many members of my family might have had it before I consider myself to be at risk?
Okay, if we go back to that example we've just talked about, that's a really good start place. So we mentioned an aunt in the family on your father's side. So that's one generation of the family. Yeah, if we look at it across, that's all your father's generation. And then her daughter, she's your cousin. Now, she's had cancer, so that's the next generation down, which is the same generation as you. So you're all in that new generation now. But what we'd be looking for is another generation to have it. So we're looking across 3 generations. So it could be someone like your own mother, or it could be a sister, a brother, your father, but it's someone else that's close, or even your own son and daughter if they were of an age where they started to develop that cancer. So that's really what we're essentially asking for, 3 generations of the family, a history that goes that far, and particularly if they've had cancer very young, under the age of 50. That in itself is a kind of signal to think about what's happening in this family.
You are still listening to Radio Focus on Sky Channel 0185 on our Super Morning Show. With me in the studio is Anna Alford from Genetic Alliance UK. Explaining more about genetics in cancer. Anna, after all this that you've talked about, if I do have a family history of cancer you have mentioned, what should I do?
If you're at all concerned, you're worried, you're anxious, then you should ask your doctor or your nurse to discuss this with you, and then take along all the information that you've found out, because that's really essential that they look at everything that you've discovered.
What kind of services are on offer for those who are considered to have a risk of familial cancer?
Well, in the UK, the family doctor, often called the GP, they might refer you to our NHS services that specialise in breast care. So if we're looking at breast cancer again, sometimes there's a special family history clinic where you can go and talk about all this information. And they don't just examine you, they also look at this information because they want to assess you for how much risk you're at of having cancer. And when we talk about risk, again, it's a funny sort of thing to talk about, isn't it? What's your risk of doing something? What's your chance of getting a disease? But that's how we work in genetics. It's essential that you think of yourself as being at risk in terms of ordinary, normal population risk for cancers. Lots of ladies develop cancer. Lots of families will see more than one cancer in their family, for example. But a familial cancer, an inherited cancer, gives you a much, much higher risk. And that's why you need to think about that and maybe inquire about that. So normal population risk, we're all at risk of cancer.
Anna, how do these services help me?
Well, your GP can refer you to these specialist services, and you could have, for example, a lady could have a special X-ray, which we call a mammogram. It's very simple. You just undress to the top part only, and then you would have this X-ray. It's not invasive at all, so nothing is going to happen to you. You can have this with just ladies present, so healthcare workers who are just females, so that you retain all of your dignity. You don't have to have a gentleman look at you, and then they'd look at the X-ray and they'd try to work out if there was anything different or changed about your breasts. Lots and lots of ladies have lumps and bumps and different pains and different feelings of tenderness in their breasts at different times of the month, and ladies kind of learn what's right and what's wrong, but sometimes you get a little bit worried and think, well, that lump has come up and I should perhaps go and see someone about that.
Anna, if I'm considered, where can I go for more information, finally, before you go?
Well, we've kind of put together a couple of different charities in this country. Macmillan, in particular, is a really good starting place, and there is a telephone number that you can ring in, and there's also a website that you can go on to get more information. So if I give you the number now, it's 0808 808 0000. There's also an organisation in this country based in Nottingham, and they are called BME Cancer Communities. Now, this organisation, as you've probably guessed, BME we tend to use that for black and minority ethnic communities. So that's a recognised term.
Okay.
And they deal particularly with people from ethnic minority backgrounds who are concerned. And their phone number is 0115 934 8482, and they also have a website that we can give out. But if you want more information about our report and our study, then you can certainly contact Genetic Alliance UK by going onto their website, or you can email me, which is Anna at geneticalliance, all one word that is, .org.uk.
So you heard it for yourself. If you need more information about the interview that we just did, you can go to www.macmillan.org.uk, or you can phone them on their number 0808 808 0000, or you can go to BME, or you can also call 0115 934 8482, or you can also go to Genetic Alliance, their website www.geneticalliance.org.uk, or you can send any question or anything that you want to know more about to Anna at geneticalliance.org.uk. Anna, thank you very much for coming to this show this morning, and we are grateful. Anytime that we need more clarification, more explanation on this, we will still call you upon you again for you to help us.
Thank you, Nana.